Welcome to the second webinar of the workshop on suicide prevention in Indigenous communities, hosted by the National Academies of Science, Engineering, and Medicine's Forum on Mental Health and Substance Use Disorders. I welcome our virtual audience today and those who are viewing the recorded telecast. I want to thank the members of the Planning Committee, federal partners, the presenters, and especially the Forum staff, who've done an extraordinary job in organizing this. I am Bill Beardslee from Boston Children's Hospital. I've served on numerous National Academy committees, and I am the co-founder and a member of the Forum on Children's Wellbeing, a collaborating partner for this event. This workshop, and I'm also the co-chair for the Planning Committee. This workshop is also sponsored by the Office of the Assistant Secretary for Health, Indian Health Services, the Substance Abuse and Mental Health Administration, the Centers for Disease Control and Prevention, the National Institutes of Mental Health, and the Eunice Kennedy Shriver National Institute of Child Health and Human Development. Although this will be a virtual workshop, it is being hosted from a physical location in Washington, D.C., the home of the National Academies and the Forum. For that reason, I would like to acknowledge and offer our deep gratitude and respect to the Nuncoach Tank Piscataway people and elders, ancestors, past, present, and future, everywhere in the United States, where our speakers and attendees find themselves at this moment. They are on the lands of Native American tribes and peoples. Our first webinar was held on April 22nd. An excellent beginning, providing an opportunity to understand the opportunities and challenges. We learned that culturally bound knowledge and practices based on traditional beliefs such as prayer, familial bonds, land, and language is foundational to the health and well-being of Indigenous people. Such existing practices strengthen the resilience and can ground a person's or a community's sense of identity and self. The intergenerational trauma brought about by colonialism, adverse childhood experiences, or ACEs are contributors to the overall health, high-risk behavior, and onset of disease and early mortality. ACEs disparities are more prevalent in Indigenous communities compared to non-American Indian communities. We also learned that data on American Indian and Alaskan Natives is often incomplete because of racial misclassification and inconsistent data collection. However, throughout the entire program, the strength and resiliency of Indigenous communities was highlighted, and successful models of suicide intervention requiring culturally appropriate research and a community-based approach were emphasized. Presentations from Webinar 1 are archived on the event page, along with the recording of Webinar 1 for free. During today's webinar, we will begin with a prayer from Sade Hart of the Hawk Ali, hear from our keynote speaker, Dr. Joseph Gaughan. Then session 1 will feature suicide interventions along with time for Q&A for each program. After our break at 1:40, this is all Eastern time, session 2 will discuss implementing and sustaining suicide interventions from a community perspective. And at 3 p.m., again Eastern time, session 3 will highlight additional innovative practices. Please submit your questions in the Q&A box for each session to discuss. My co-chair, Dr. Teresa Protke, will adjourn the event at 4 with closing remarks. Today's workshop was organized by Planning Committee members James Allen, Justin Coffey, Sade Hawk of the Hawk Ali, Virginia O'Keefe, Mental Health and Substance Abuse Disorders Forum member Kathy Pham, Lisa Wexler, and was co-chaired by myself and Teresa Protke. The Planning Committee was supported by the Committee staff, Ale Andrada, Adrienne Fomentos, Anacia Wilkes, and Aaron Fox. I especially want to thank the staff who've made this workshop possible and have been gracious and thoughtful throughout the planning process. This is the second of 3 webinars for this workshop. Our last installment will focus on gaps and opportunities for action on June 10th, again, in Eastern Time from 11 to 4. We view these as an organic whole and hope that you will continue to join us. We think this is an incredibly important topic, and this forum and this workshop provides an extraordinary opportunity to initiate a dialogue together that we hope will continue long beyond the end of the workshop. A recording of today's event will be available on the event page. Please refer to the meeting materials for a full itinerary of our program and full bios and CVs for all presenters. Each speaker will introduce himself or herself. I will now invite Sade Hawk of the Hawk LE to open this workshop with a prayer. Thank you very much.